You're live.
Hi, good afternoon, everybody. Welcome to this meeting of Derby's Health and Wellbeing Board. Thank you for coming. I've got apologies from Councillor Ashby. Any other apologies?
Yes, quite a few. Emma Eldred, Lucy Allen, but Jim Austin's covering. Andy Appleyard, but Gamel's covering. Denise Baker, I think Andy Mabala's covering. Ian's here now. Paul Brookhouse, Ellie Gillard, she's been covered by Clive Stanhope. Dean Howells, Kathy McLean, Jane Needham, Mark Powell, Andy Smith, Gis Robertson, Debbie Price is covering, Sue Ann Lim, Carl Tring-Willis, Alan Reid and Amjad Ashraf. And that's the end.
Thank you, Lindsay. There are no late items. Are there any declarations of interest? Thank you. And do we all accept the minutes of the meeting from the 13th of November last year as a fair record of the meeting? I'll take silence to mean acquiescence and therefore agreement. Is there a slight echo on this? Do I sound okay? Yeah, no, there's a slight echo coming back to me, but that's fine as long as it's not echoing across the chamber. So then very quickly moving on to the Health and Wellbeing Board plan. I had a look at this earlier. There's most things are in progress or complete. Just a couple of points about the air quality issue, which I spoke to Councillor Kerr about a moment ago, and she's taking it up with yourselves, I think, who are looking into this issue of that air quality, which is completely, which not completely, but it's separate to your report today, Carl, obviously. And then the other thing that I think we were a bit remiss on, Alison, I just noticed, is that we did say we'd have an update on infant mortality, and that's actually in the diary for now. So have you got any update on that?
Apologies. So yeah, it's moved to the next agenda. So it's on the agenda for March, where we're looking at a kind of children, young people themed.
Okay. Yes, that's right. Sorry, thank you. Yeah, that makes sense. Thank you. Yes, because we've got quite a full agenda today. Okay. Well, moving quickly on then. I'd like to introduce Carl Jasitsky, who is going to present to us Derby's annual air quality report. Thank you, Carl.
Thank you, Chair. So yes, I'm Carl Jasitsky. I'm a Senior Environmental Health Officer here in the Environmental Protection Team at Derby City Council. Part of our remit within environmental protection is air quality, and that's outdoor air quality. We have a remit under what's called the Local Air Quality Management Regime, which is set by government. I know we have a requirement, as all local authorities do, to monitor and report on air pollution within our local areas. This is part of a national requirement that's placed on the Secretary of State for DEFRA, in order to report on air quality and put in place actions where we are potentially breaching as a country objective levels for various pollutants. It's very specific in terms of the pollutants that we're asked to monitor. It's not sort of general air pollution, and that's over the years. It's sort of been honed down into the ones that are of primary concern associated with particular sources that we have in the United Kingdom. And this report that I've brought to the board today is something we're asked to do annually as part of that local air quality management regime. We report on monitoring that we carry out in our area. There's also a couple of sort of permanent monitoring sites that the government operate as well within Derby, so we include the results of those also. And the primary focus of the report tends to be, and has been for some time, focusing on the pollutant nitrogen dioxide, NO2, but with an increasing focus on fine particulate matter, PM2.5. And that follows some changes that came forward under the Environment Act 2021, whereby there is now a target, which there hadn't been previously, a more stringent and target for particulate pollution within the United Kingdom. So the report contains, A, the results of any monitoring that we carry out, and also the current measures that we're carrying out in order to try and reduce the concentrations within our local area. We have, when a local authority is potentially in breach of the objectives for a particular pollutant, we are required to declare an air quality management area. We have one air quality management area now in Derby. We did have two until about 12 months ago, where we revoked one of them because the concentrations in that particular part of the city, which was around Spondon and the A52, had reduced sufficiently that it wasn't required anymore. The report in terms of nitrogen dioxide monitoring, which is where the air quality management area focuses, it's nitrogen dioxide where we're close to breaching, or where we have been breaching in previous years. We are now at the stage where we have coming up to the third year. So this report relates to 2024 data. It was a report that was actually produced early in 2025. It was published in July 2025, so it's not a new report, and it has already been sort of approved and agreed by both DEFRA and, of course, our Cabinet Member for Regulatory Services back in July, August time. But I know that this has been brought here because there was some, it's been asked to be brought because it connected to an item, I think, that came up at a previous Health and Wellbeing Board meeting. And so really it's here for information only. There's no recommendations other than to note the report. But obviously we're here if anyone has any questions regarding the content and any queries that might relate. So I shall hand back, and if there's any questions, then let me know.
Thank you, Carl. Whilst there is no room for complacency, before I bring in any people with questions, I would say that on page 4 of the report, it says that this is the second year in a row that all pollutant concentrations, including nitrogen dioxide, have complied with the national objectives at all monitoring locations in Derby. And that's a very good position to be in, and it's a credit to you and the work that you do. So I thank you for that. Any questions for Carl? Any comments? Lucy? Councillor Kerr.
Can I just echo your comments about things seem to be going in the right direction, because it's really good news, and obviously the council has taken action over the years to try and do that. Not all of those actions have been popular. For example, the changes in traffic layout on Friargate area to reduce concentrations, I think, on Stafford Street have been successful, but people really didn't like the changes for other reasons. In the report, it's talking about some of the other actions here in terms of looking at bonfires and to better understand the number of residents using wood-burning stoves. Now, wood-burning stoves, I know, are one of the significant causes of particulate pollution in cities, but that isn't, people still think of them as being, well, it's wood, isn't it? It's good to use wood because it's a natural resource. And I just be interested to know how that survey is getting on, which was due this year, and whether the results maybe need to come back to here as well.
Carl?
So we had prepared a draft for the survey. It was due to be published. The plan at the moment is it has been delayed, and the plan at the moment is to combine some of those questions with some further work that's being done as part of the climate change agenda on heating the home. And so there is still a need for gathering that data, but the survey hasn't gone live as it stands. I mean, in terms of the national data on wood-burning stoves, obviously it is national data, and so it would be useful to know how. I mean, first of all, it's the number of stoves that people are using in their homes, but then it's obviously how they're being used, and that's something that's very, very hard to determine without going and knocking on doors. And that was obviously the purpose of the idea of the survey. government are increasingly asking local authorities to do further work to try and reduce emissions from wood-burning stoves. I think government probably acknowledge that it's quite a politically sensitive issue. Certainly, what they don't want is another situation that happened where everyone was told to get diesel vehicles, and then we realised that they were producing particulates. And I think there's some concern about that being another issue, that everyone was being told to get wood-burning stoves because it was good for the climate, and now we're realising that that particulate emissions are quite serious from wood-burning stoves. So I think the balance at the moment, the general advice is, there is it's not against the law to use a wood-burning stove, as long as you're using it in the right way. And I think that's the key message at the moment, is make sure your wood's dried, make sure that your appliance is, been well maintained, and various other measures. There's a couple of government campaigns, such as the Burn Better campaign, which we sort of sit along with, and we put on our website in terms of information to try and reduce emissions from wood burning. So I don't think there's anyone saying, people should stop using wood-burning stoves, certainly in terms of government advice at the moment, but obviously we do need to acknowledge the potential health impacts from using wood-burning stoves and particulate emissions.
Thank you, Carl. And I know you're at the whim of various unclear and often a bit contradictory and confusing expectations of government and the regulations around this. So I appreciate it's not a straightforward situation as it could be, because the expectations from government are not clear, I think. But thank you. I just have a quick clarification point, if I may, because I don't know what this means, and it might be that it's just that I don't know. In the conclusions and priorities, and you cite this in your covering paper as well, you say the boundary of the inner outer ring road AQMA is out of date, and work is being undertaken to redesign the boundaries of this AQMA. Forgive me if this should be obvious, but what do you mean? What does that mean?
So the boundaries were written up primarily. The main source of nitrogen dioxide when those boundaries were written up in terms of where we were potentially exceeding the national objectives for NO2 relate to roads. Obviously that's the primary emission source for nitrogen dioxide. And when the AQMA was written, it was some years ago now. It was actually originally sort of early 2000s. And as you can probably imagine, there's been changes to the road network. I think the key change that still hasn't been, unfortunately, implemented in our air quality management area is that it still follows, would you believe, the line of the old inner ring road. So the new Lara Croft Way and the junction changes around at the end of Stafford Street, they haven't been updated within our air quality management area. So it would be, it is something that needs to be done. It's something that's on our list of things that require attention. I think one of the hesitations at the moment is the fact that we've been compliant for the last 2, probably 3 years. Obviously, we're just reviewing the data for 2025, but it looks like the concentrations are even lower again. And in that circumstance, what we start to do is present a report for DEFRA to make a recommendation for revoking the air quality management area. So I suppose it was a case of, if we're already going to be revoking the AQMA, was it worthwhile going through all the effort to realign the boundaries of the AQMA if it was on its way out? But we might not be there quite yet. If anyone's picked up from the recommendations from DEFRA on the report that we submitted in July, the national guidance for when you can revoke an air quality management area, it's not that you're just falling just under the limits. You have to be at least 10% below the limits. And that's to account for inaccuracies with the monitoring method that we use, which are diffusion tubes. They're not deemed to be perfectly accurate. They're very consistent. They're a very good indicator, but they're sort of plus or minus 10%, certainly in terms of the policy on whether you should revoke. So that's the current position.
Okay, right, thank you. That clears that up. Councillor Hazelgrave?
Thank you, Chair. Looking through the report, on page 9, measure number 21 about school safe havens, it's great to see that we have expanded the number of safe havens. It's an issue which obviously improves air quality if there are fewer cars arriving in the vicinity of a school. And it's also making that area more safe, as little ones, you know, quite young, are actually making their way from a car to the school itself. It's regrettable that local opposition and creating parking issues on nearby roads are main barriers to implementation on further school sites. You would think that there's health and safety issues, health through the air quality and safety through vehicles basically driving past the school, because it's not a school safety zone, should be overridden by the fact that it is a health and safety issue, and that, you know, mitigation should be put in place so that those school safe havens can become a more prevalent feature in the city, and maybe change the habits of parents in terms of how they get their children to school. Some are in walking distance and choose to do that. And that it'd be interesting to see if behaviour has changed in those existing and well-established school havens, because there are all sorts of benefits for the air quality around the city if fewer cars are being used at two concentrated parts of the day. Basically an observation, and I'd be interested in how, and I know the area of consultation on providing a school safety zone isn't part of your responsibility, but do you have any input, for example, into such a report and clearly state the benefits of such and the potential for residents in the area, never mind children and parents going to the school and the staff in the school? Yeah.
Through you, Chair. So yes, we are involved in the School Safe Havens project. Obviously, our main support is on the sort of technical air pollution side. What you'll notice if you go into the detail of the results within this report that I've presented today, we have a number of sites where we are monitoring nitrogen dioxide outside of the schools. Not only sites where we have school safe havens in place, but also some that are thinking about putting a school safe haven in place, and that is part of the process to obviously encourage schools to get on board, to show them what the benefits potentially are, not just from air pollution, obviously, but also the other things you mentioned, and of course the other factor is reductions in obesity and health for children walking and scooting and whatever else to school as well. So there's so many benefits to these school safe haven schemes in terms of health that yeah, I completely agree with everything you've said there. But yes, we are part of that programme. Obviously, it's a transport department-led project, but we are working closely with them.
So thanks ever so much for the work you and your team do in this really important area. Thank you.
Thank you, and thank you, Carl. Are there any further questions or comments for Carl? No? Well, thank you for coming back with that report. It's really appreciated. It's good to get such a positive report. I know there's a thorny question of WHO levels of safe levels of pollution as well. So it's all, but within the context that we're working in here right now, within the expectations we have, it's good to know that we are doing what is required of us and what we can. So yeah, we'll look forward to your next report, Col. Thank you for your work on this, and yeah, thanks a lot. And now I'll move on then to tobacco control in Derby, activity in progress, and Siobhan Horsley. Thank you.
Thank you, Chair. Is that picking up okay? Yep. Great, so we've tabled the paper, we're just bringing an update really on activity of the last year and what we're looking forward to doing in this year coming. So we've got a few slides that just summarise some of the information in the paper, update a couple of things within the paper as well, so we can just take you through those. So as I've said, we're just doing a short update today and highlighting our future priorities. I just wanted to flash this up for everybody. This is taken from the Tobacco Control Needs Assessment, which was completed a couple of years ago and brought to the board at the time. So I just wanted to highlight some of the...
Sorry, Sean, can you just, Siobhan, would you just pause for a second? Because we're not able to close these doors.
Okay.
Is it? Sorry, Siobhan, I find it difficult to hear. I'm very distracted by the voices over there, but obviously it's just because the doors can't be closed. But anyway, so carry on, thanks.
Yeah, that's all right. Thank you. So I just wanted to, I'll try and speak more clearly as well. I know we've got the microphone, I'll do my best. So I wanted to bring the needs assessment back to board, just to highlight really, there's a lot of the challenges still remain. So we do know that smoking remains the main cause of preventable illness and premature death in the city. We know there are inequalities in smoking prevalence and tobacco use across the city. And we also know that this has quite a high cost, both personally and both to people and to the NHS and to general society costs. And we also know that a whole systems, because of all this complexity, that a whole systems approach is what is most effective in tackling this issue. Some of the points of difference to this slide, bearing in mind we're a couple of years on now, is that the current smoking prevalence in the city is 12.8, so we're seeing a slight reduction from 13.2, which it was a couple of years ago, and our smoking rates in pregnancy or smoking at delivery rates have come down to 8% now. So we are seeing some movement in the right direction. So just moving on through the slides. So as I've said, we're taking a systems approach to smoke-free Derby and Derbyshire and tobacco control. So I'm here on behalf of our team in public health and in Live Well, work in partnership with other people in the room as well as our counterparts in county to kind of oversee and coordinate this quite complex area of work. So some of the challenges that we've had over the last year is we're waiting for the tobacco and vapes bill to come through. So we've just been, and that will kind of help provide some certainty around future planning and investment and so on. We did have some uncertainty of tobacco dependency treatment funding, which is the offer that's provided by county and located within our trusts. And that we have had funding secured for next year, and we're aiming to secure a 3-year funding now. And that's a correction from the paper. The paper said public health grant, but it's actually ICB resource. There's challenges, as we'll know, about moving towards smoke-free. It's a very complex environment, lots of things to take into account. The grant that comes to public health for stop smoking services has very ambitious quit dates, and rightly so, because there's these long-term ambitions that we have of really bringing smoking down. So yes, that's a challenge that we work with. And as well as we focus on groups that we haven't reached before, it becomes more complex and people require different sorts of support, and we know that one size doesn't fit all. So, the team are working hard just to adapt their practice to be as effective as possible. Just moving on to progress and achievements then. So with all of that in the context, this is what has been going on. Our quit rates have increased, and we do think we're reaching groups previously not reached. So in 2024-25, just over 1,200 people in Derby set a quit date, with 60% of people successfully quitting at 4 weeks, which is a good conversion rate. We have, working with our counterparts in the county, we have commissioned an organisation to support us to develop and deliver tobacco control campaigns. So this year we focused on both the general population and some high prevalence groups. So, and we've particularly worked with our partners in health and social care as well to deliver those. The tobacco dependency treatment, which is the acute provision, it's really, we're starting to see an impact from that, and the take up from that is good. There's also, which will add to the offer around smoking for pregnant smokers, there's a launch of a financial incentive scheme, which is a national scheme, which we're just working out how that delivers locally now. And then trading standards as well. So we think about tobacco control. We're not just thinking about Live Well and that stop smoking offer. We're also thinking about illegal tobacco sales and work with partners to address underage tobacco sales. So they've been working hard in that kind of branch of the work as well. Just moving on. We've recently, just before Christmas, did a bit of a planning session to think about what our priorities are for next year, and there's a little bit more of kind of self-reflection. There's an evidence-based approach called the CLEAR assessment to tobacco control, and we're going to run that through our tobacco control structure with partners to think, well, is there anything we're missing here? Is there anything that we can improve? So that's kind of quite a robust way of self-assessing. We've still got this ongoing relationship with the social marketing organisation to deliver 3 further campaigns, but really looking at insight and really we've done some work really kind of general population, but really tailoring what we're doing. Is there any more support we can provide there? It feels like there's lots of opportunity to work closer with our clinical partners. So that feels like a real area of focus for us. So people coming through targeted lung health checks, emergency department, pregnant smokers again. We do need to understand our and just the implication of vaping more and give that some attention and what that might look like going forward. We've had kind of quite a focus driven on the smoking side of things, but we're just obviously vaping is an issue that comes up over and over again, and we really need to think about that. And then again, all the time, just thinking, are we offering an equitable service? Are we really targeting the people that really need that support and giving them a level of support that they can benefit from. So yeah, that's where we're looking. And that will all start to take shape over the next few months as we go into the next financial year. So that really was what we wanted to talk to you about. So just a bit of reflection backwards on where we've come from, big programme of work involving multiple partners. There's quite a lot of energy around it, and it's really important to keep that momentum going into then next year and future years so that we're building on successes, but also really trying to fill some of the gaps and learning about what our gaps are so we can kind of address this quite fully. So so I'm happy to take questions. Thank you, Chair.
Thank you, Siobhan. I mean, that's really helpful. I mean, it's basically, on the whole, in many respects, it is, there's some positives in this, aren't there? Some good aspects to it in terms of the number of people quitting and reducing smoking. So certainly a positive report, I think. Are there any comments or questions for Siobhan? Nikki?
Thanks, Siobhan, and it is good to see the progress. I'm just particularly picking up on the bit around NHS and local authority working together around next steps. I'm really getting into the kind of community neighbourhood route. We're about, as a Health and Wellbeing Board, we're about to be asked to develop neighbourhood health plans together that will really start tackling things like that, and this is clearly going to need to be a priority within that. So I think we need to make sure this, and actually I could have said some of the same things around the air quality and the active travel and stuff. I think there's a real opportunity in our neighbourhood health plans to start getting to some of those wider determinants and prevention agendas as part of that.
Thank you. Thanks, Nikki. Yeah, and I think that it's working towards that structure, isn't it? That infrastructure around us that enables all this joint working to happen, which will be really positive and help that go forward. Thank you.
Thank you.
Thank you for the report. It's quite encouraging that you are considering taking the whole systems approach to smoking cessation. So I'm just wondering if you could provide us some examples of whole systems approach that you are taking, or whether the examples of the activities that you've highlighted are part of that whole systems approach into smoking tobacco control.
Thank you. That's a good question. I think much of what we've highlighted is speaking to that. So I suppose where we talk about whole systems approach, we're talking about, yes, the service offer from Live Well that Rob's team manages, but also our trading standards colleagues working with supply of cheap and illicit tobacco, working with our health colleagues, as we've said, looking at, well, actually, is there, so if somebody is presenting for a targeted lung health check, at the moment, we don't have that connection to take some to offer somebody a stop smoking service, and is there opportunity? Well, obviously we can, but actually, is there an opportunity around co-location and really, you know, we have good working relationships with all these partners, but can we do more around the structural pathways so that we can kind of support clients, individuals, residents in the city through those different touch points better, so they get a much more rounded offer from us as an entire system rather than a collection of services. Does that help answer? Or is there something you'd like to see that is not there, or that you're interested in?
That's very helpful. I could just offer that the university has got quite expertise on this area. So. And we have in the past reached out to provide those assistance. We still the offer still stands.
Yeah, and I think we can follow that up again. Yes, I'm aware there was some previous work around the cheap and illicit and so on. So thank you. Thanks for raising that. Thank you.
Thanks. Could you turn your mic off, please? Thank you. Councillor Kerr?
I'm really excited by this because some of the figures that have come down, I think, are quite dramatic, particularly the one you mentioned in terms of pregnant women and the way those numbers have fallen. It's really encouraging. But two questions. One is whether those people are, and other people who are quitting, are moving into vaping, and we're seeing that drop more as a transfer from smoking to vaping, and whether we're monitoring the vaping levels as part of sort of future, give us a baseline for future data. And the second thing is, could we be doing more to work with employers and getting employers to encourage their staff to be taking up smoking cessation? Because it'll probably improve their absenteeism and the like, their general health of their staff, and therefore it'd be no advantage to do so. Is that something we've explored?
Thank you. So I'll take the second question first. So yes is the short answer. And I think where we do have good relationships, say with health and social care, with Derby Homes, with others, I think there's certainly opportunities to expand that and support organisations and businesses to understand more what the offer is around smoking cessation and how it can support their staff. Colleagues may know if there's anything else specific going on there. And then, on the second question, I was going to just ask Rob to respond to that, if that's okay, who oversees the Live Well service, who has a bit more of a sense on the ground, kind of what the direction is, just to give a quick response. Would that be okay? Is that okay, Chair?
Well, thank you. So in terms of following people going from quitting smoking into vaping, we don't follow them longer term post their quit and their successful quit or non-successful quit. What I can say is that of the 1,200 people that have set a quit date so far this year to date, around about 200 people have used a vape either on its own or concurrently with NRT, so patches, gum, etc., to help them quit. Some of those people, throughout their quit, decide that actually they don't want that new crux of something that new reliance on something different. Some of them are quite happy to go, and they're quite happy that they've quit and they're smoke-free and they go on their merry way. For those people who are interested or want to, or show an urge to, actually, I don't want to be on this, we support them as they go through their quit attempt in the same way that they would do if you were using patches, for example. What you would normally do is you step down, so you have a high dosage at the start and that steps down over a 12-week period. With a vape, they would have a higher dosage and that would step down as it goes. But at the end of that 12 weeks of getting that support, they still have the vape and they still probably have a little bit of the lowest form of liquid left. So they may choose to continue or they may not. So that gives you an idea, around about a kind of idea, but we don't follow them longer term than that. Does that answer that question? Probably doesn't give the full answer that you want, but it gives a bit of an idea. And just to add to Siobhan's point around workplaces, so as a service, we actively engage with workplaces through different areas of things that we do. So as an example, we're in Rolls-Royce, Alstom, we've been in Toyota several months ago. We're in some smaller businesses as well, just as a way of promoting the service. And one of those campaigns that we are looking at is around routine and manual workforces. So engaging those organisations that have those employees as well.
Thank you, that's really helpful. I mean, the situation with vaping, I mean, I'm not up to speed with the latest position on this, but I think it's unclear again, isn't it, in relation to views on vaping and advice and regulations. Is that correct, Robin? Just I'm sorry, that's probably quite a complex answer, but just to...
So the simple answer about vaping is that if you're a smoker and you will be unable to quit any other way, then vaping is much less harmful than continuing to smoke. And they are the individuals that we'd be really keen would try the vaping. If you don't smoke, don't vape. So we wouldn't want anybody to take up vaping when they weren't a smoker. And if you are a smoker and you can quit using the nicotine replacement and come off nicotine entirely, that would be the much preferred way. But ultimately, if you can't quit any other way, then switching over to vaping is still less harmful than continuing to smoke.
Okay, thank you. I'm going to ask my question first, Councillor Heathcote, then I'm going to bring you in. Okay, so thank you. I suppose I've got a couple of points really. If we look at this rates of smoking over time, over recent decades, have dramatically reduced, haven't they? So that in itself is I suppose it's a public health achievement, isn't it? And it's a change of social attitudes, I suppose, which I won't wax lyrical on because I have some people in the room have heard me talk about this before, so I won't bore people with that particular my assessment of that. But there has been a change in social attitudes in some ways, and lots of campaigns. I suppose there's a point at which I wonder, you know, to what extent you get to a point where there's diminishing returns in relation to the numbers you can encourage to stop smoking, simply because, you know, there'll always be certain people who do certain activities. I just put that out there, really. I'm not suggesting we necessarily have reached that point, but I suppose that's always something to take into account. And the other question I have, Siobhan, is that on 4.5, where you talk about commissioning insight-driven campaigns focused on key populations, I mean, I can see that certain campaigns are going to speak to some people and not others, and I think that's true for any marketing person will tell you this, won't they? And you know that. I suppose when you say the smoking rates are higher, a risk of harm is greater, I wonder if you could... So some of the things that are listed, groups that are listed there were some ethnic groups, pregnant smokers and healthcare workers. Well, I can see readily the point with pregnant smokers, but, you know, I would suggest, for example, why would it be healthcare workers? Do they have particularly high levels of smoking? Thanks.
So, yeah, so I suppose on your first point around smoking prevalence and where you aim, so the national aim is to get down to 5%, and that's kind of smoke-free aim. So we've still got a distance to travel there, but it's kind of useful to have that in mind, isn't it? We know, so compared to the population as a whole, smoking is more common amongst people with a mental health condition, people on lower incomes, people who are unemployed, experiencing homelessness, people in contact with the criminal justice system, people who live in social housing, without qualifications, lone parents and LGBT people. So the evidence is there for certain groups. I think the work that we're doing with health and social care, a lot of that is around supporting them to support others. So that might be a nuance to to how that bullet point is made. So it's supporting them to be able to support others to quit smoking and refer appropriately and easily into services, as well as being able to access them for themselves should they need it.
Sorry, I didn't catch all of your words there. Sorry, I can't. But so are you saying that the focus on healthcare workers here isn't so much about the fact that healthcare workers themselves have higher rates of smoking or suffer greater harm? It's the fact that the aim is to help them to get other people to stop smoking. Is that correct?
Yeah, it's a combination, I would say. So it's kind of working with them as within a setting, and to be able to provide an offer within a setting, and working with them to be able to then offer support to others. So it's kind of a bit of both in terms of the offer with them. So them understanding that offer is important for them to pass it on to others.
Okay, thank you. All right, I've got Councillor Hazelgrave, thank you, and then...
Thank you, Chair. Well, Marie and Dr. Robbins, some really good information coming out here in terms of outcomes, which are really positive, as Councillor Kerr alluded, for mothers who are smoking during pregnancy and leading to cessation, and continuing that cessation when baby is born. And clearly, I would imagine that a smoking mother puts a greater risk at issues at the delivery and post-delivery for baby. So that's great. And also, if there is a partner at home and both of them stop smoking, it really is a boost to the kind of atmosphere in the household that the baby will be breathing in. And this will be much better and in line with having the best start in life, which we are currently working on, and have high targets to achieve. And also, best start in life also leads to babies and little ones being school ready. And if they're in a smoke-free household, surely their ability to attend regularly when they do start school improves. So it's a win-win in all sorts of areas which are interconnected. So it's great to hear what you're doing, and I'd be interested to find out how much the money incentive approach is helping in terms of being a carrot for parents, mothers in particular, but partners, to cease smoking during pregnancy and, more importantly, maybe after.
Thank you. Yeah, so that's being introduced as an important supportive tool, really, but it's early days. So it's been recommended. So there's been pilots carried out nationally, and it's been put into NICE guidance as a recommended approach. And there's there's guidelines around that, which is informing the national approach. And then, yeah, like I say, we're at the point where we're getting our heads around it and launching it locally. It'll be our colleagues in county because they deliver the maternity element of the programme. So yeah, of course, we can bring that back as we find out. So thanks ever so much. Thank you.
Thank you. And again at the back, thank you.
Just an attempt to clarify the question that the councillor asked about the healthcare being targeted as a group that is on smoking cessation. Healthcare sector consists of workforce that is quite unequal in terms of payment. There are quite a lot of deprived healthcare workforce within that sector. So, which is, and that we know that the predominant of smoking is amongst those who are most deprived. So that explains why there is a focus on healthcare workforce. The second point that I just wanted to throw while I've got a platform is a question of the incentive initiative. So it'd be good to hear how that is working and how, if there are any, as far as I'm concerned, I haven't seen any literature that shows how those incentives are helping in terms of smoking reduction. So if you have any example of their success.
Yeah, I mean, I can share what we've got and talked about it in more detail, outside of the meeting. But yeah, and then bring it back if board members are interested later on. Thank you.
Thank you. Any other comments or questions for Siobhan on this? No? Well, thank you very much, Siobhan. I mean, it's quite a positive story, really. I know there's more work to do. But I know that, as Nikki said, it's going to have to become, it's going to be a focus of the neighbourhood plans, isn't it? And this body will be looking more closely at that in due course, won't we? So that's quite an interesting and exciting development for the Health and Wellbeing Board, isn't it, Nikki? So, don't know if you want to say, you can say a little bit more if you want to there, but I just...
Well, I'll just say, because one of the things I'm conscious of is that because we're in a hiatus of planning guidance coming down to us, and Robin and I have spoken about this as well, and Jim, we're really aware that there may be asks that come of the Health and Wellbeing Board that are rapid and fast. So we're really keen that we don't just pay lip service to the neighbourhood development and we create the time to do that right. So we'll work with you as chair to make sure that we're doing that in the most practical way.
Yes, I think that would be an interesting and positive development for. I think it's necessary. I agree, and I think it would be an interesting and positive development for this board. So I look forward to that. Thank you. And yeah, I'll talk to you outside the meeting actually about another point, this administrative point. But thank you. Okay, thank you. Thank you very much, Siobhan. That was a great report. Thank you very much. Is it quick, Councillor Heathergrave?
Yeah, it's just about the recommendations, Chair. I'd just like to maybe add to thank all staff in health and the council in their progress and hard work in reducing the amount of smoking. That could be tidied up in terms of wording, but that's the sentiment I'd like to put across, as well as 2.1 as it stands.
Okay, thank you very much. I'm sure everybody would agree to that. I don't think there's be any dissent in the room on that one, Councillor Heathergrave. Right, thank you very much. Our next item on the agenda is Heather Greenan, who's just walked in. So it's on action to reduce poverty and its impact in Derby. So as you're sitting some way back, Heather, I mean, I know you don't have a quiet voice, but if you could talk loud, into the microphone, that would be really helpful for me. Thank you.
No problem. Thank you. So I'm Heather Greenan, Director of Corporate Management here at the City Council, and I'm here with my colleague Jenny Wizard, who is our Policy and External Affairs Officer. So what we've been asked to do is just an update around the anti-poverty strategy. We, I think, came to this board several times actually during the early part of last year. I think just really to describe the journey that we'd been on, I guess moving from the cost of living crisis into, feeling the need to address poverty and inequality in the city more fundamentally through a longer term strategy. So that is what we have been working on. So it was just really to give you an update here today. So they are the 4 areas that we're going to touch on. I just wanted to reassure the board that there is an extensive cost of living partnership offer that I'll just touch on briefly. I wanted to talk about the Resolve Poverty Review. So Resolve is a national organisation actually based in Manchester, real expertise in poverty. They were commissioned by the Poverty Commission to have a look at how we were working, our governance arrangements, and so I can just talk a little bit more about that review and where we are. The government, I guess we've also been waiting for the government's child poverty strategy. So my colleague Jenny has digested the strategy which came out just before Christmas. So again, we'll cover that. And then I just really wanted to talk about next steps. Okay. Next slide, please. Thank you. So in terms of the cost of living partnership offer, and it is a really true partnership offer. We've got, as well as the Poverty Commission, we have an active poverty action group that really does the kind of review the offer and identify gaps, and we try to fill opportunities where we know that families and households in the city are struggling. So certainly there is access to basic supplies. So that is led through our Food for Thought Alliance. But there is still a real need in the city for items such as clothes, furniture, electrical goods, as well as food. And certainly that is an offer that is available to the communities, and certainly has had a very busy period, I think, over the winter. We provide a range of welfare support, and this is increasingly important. So that includes discretionary housing, council tax support, we try and use different types of funds, whether it be a winter essentials fund and a local assistance fund. And so our welfare and our benefits team do some really critical work, with people who do turn up destitute actually in the council house. And where possible, we are offering, practical support and opportunities to access benefits. So certainly that remains a critical part of the offer. We are continuing to use the Household Support Fund, and that is including the provision of warm welcome hubs across the city, working closely with the likes of Community Action and Derby Homes. And also we're able to offer food and energy vouchers to households in the city. The food is particularly critical to families who are eligible for free school meals. And they receive vouchers in the holidays just to cover them over the period that schools are closed. Now, the Household Support Fund is of interest, partly because it is actually being, there is a new version of the Household Support Fund, which is coming in from April, which is called the Crisis Resilience Fund. So what we are currently doing is exploring the implications of that. It's positive because Household Support Fund was often in the past just issued on a 12-month basis. So what it meant was that it was difficult to plan ahead. Now, that has been addressed, and the Crisis Resilience Fund, the idea is that this is a more permanent way of providing welfare support where it's needed. So we're looking at the implications of the Crisis Resilience Fund and can provide more details on that at the moment, but the guidance only came out at the end of last week. We are, sorry, going back, and I'm probably talking too long. But we also, through the Holiday Activity
it's
Fund...
fine, we do have time. So,
Okay.
And so I think this, I mean, everything we've heard thus far today is extremely important, and I think this is extremely important. I'm sure other members do as well, so don't worry.
Thank you. So we also provide through kind of access to free holiday clubs. Again, that's for families eligible for free school meals. And there is, a really great range of activities tapping into, I think some of the community organisations that we have in the city, and that to provide free holiday clubs. And then I guess the final area where we're continuing to develop the offer is I think we've had for the last year, 18 months, we've been using what's called LIFT, which is a low-income family tracker tool, which is part of, it's a national offer, part of policy and practice. But this is a really great tool because it enables us to target households. It's actually based on housing benefits, but what it does do is it enables us to identify any households that we think may be eligible for a wide range of benefits. And what we've been doing is actually writing out to those households, kind of running specific campaigns, and then running benefit awareness support sessions. And I know Councillor Chambers has been instrumental in leading those. So what we've done is we have been promoting take-up of benefits, such as pension credit, but offering the full range of support that I've talked through and any other benefits. So what we're able to see is that we are, for example, in the autumn, we did a campaign with around 2,000 households in the city that actually we thought were eligible for benefits. Now, actually, these people were turning up at the awareness, sessions with their letters, which does show that we are getting the message through, and that is through targeting via data. So, that kind of evidence-based approach. I do appreciate it's a drop in the ocean, but actually it's a real start in terms of being able to maximise income for those that are entitled to it. And we know that there's still a lot to go at, and certainly we're pressing on with that. Okay, so if we move on to the Resolve Poverty Review. So I mentioned that we did quite a lot of work kind of this time last year in developing what we felt were the right strands as part of the anti-poverty strategy. There was a session, a kind of a joint session of the Poverty Commission and the Poverty Action Group last May. And at that point, it was kind of felt actually to underpin the platform that we have for poverty, it would be good to bring in Resolve to just offer some insight, advice, recommendations around maybe how we're approaching things in the city. So that review was scoped up. It covered 4 different phases. So first of all, looking at the kind of doing a bit of a baseline assessment around what local strategies and data we have, the first draft of the poverty strategy, and really how they could be strengthened. That then moved on to look at the governance and accountability for poverty, action planning and partnership working, and I think perhaps most importantly is the lived experience element. So actually, how are we using lived experience to drive interventions that we're making around poverty? So a number of workshops took place during November and December, involving a wide range of partners. Those findings are being pulled together. We've seen different elements of it already, but they're being pulled together into a summary, and they will be discussed with the Poverty Commission later in January. We're then hoping to act on this to move on and to develop the, finalise the poverty strategy, and I will come on to that. But another key element that I guess we have been waiting for to just inform the Derby poverty strategy, and that is around child poverty, which is one of the strands that we're looking at. But certainly I'll hand over to my colleague Jenny, who's just going to talk about the national publication that came out.
Yeah, so as Heather has said, we've been really anticipating this, the National Child Poverty Strategy. It was originally announced by government that it would have been out in May 2025, but it was delayed, published on the 5th of December, Our Children, Our Future. Although it has no statutory elements to it, it's a significant shift in government views about poverty. A significant piece of policy intervention. We haven't seen the likes of for 10 years. I mean, the last child poverty policy strategy was repealed in 2016. So this is a significant step, and it heralds some really important elements to it that mean that we can really begin to focus in on child poverty specifically, but poverty as it affects those children and their families. So just to quickly go through some of the headline measures, the removal of the child benefit limit, a really contentious piece of benefits that was really holding a lot of children back, a lot of families back. You know, benefits only being given to families with two children, anything above being stopped. That has been heavily campaigned on by a range of people across many sectors. Government has now taken that up, and that will come into force in April 2026. Universal breakfast. Some of these have been well sort of touted before the publication of the strategy. So government obviously saying that it was going to introduce a universal free breakfast clubs for primary children. That will take effect in September. That is a significant boost in terms of supporting children living in poverty and families on low income. The expanded warm home discount, again, really important, over the cost of living crisis. That has been a real support for families needing it to actually put resources and funding into that will help us significantly at the local level. Also, the fact that, as Heather has said, the Crisis Resilience Fund, which will come into play. Sorry, what date was that? Sorry.
Yeah, it's from this April.
It's from this April,
yeah.
Sorry. It will come into play from this April, is a real significant turnaround because it means that we can now begin long-term planning with a view of really setting some key strategic aims at a local level. The Household Support Fund, good as it was, it did mean that, every single year we were having to review and update our approaches depending on the yearly annual allocation of that fund. But the Crisis Resilience Fund offers a much more long-term strategic intervention that will allow the local authority and communities to plan and more significantly look at how we can prevent rather than react to poverty and the crisis that it brings. So the campaigning continues though, because if we look at Wales and we look at Scotland, they have got strategic, statutory anti-poverty strategies in place. England is significantly behind in that way. So the campaigning continues, certainly from many across the sector, such as the Joseph Rowntree Foundation, the Trussell Trust, who are pushing for additional supports. Can you move to the next slide, please? Oh, yes, you have, thank you. Who are pushing for significant support to bolster this strategy. It is very much needed. We need a legal framework that can offer local authorities some greater legally binding incentives and targets that will support the local authority to work with partners in a much more strategic way. So that campaigning continues, and certainly Resolve Poverty, who we are working with, is one of the organisations that has been at the table with government to push this forward. And we, as a local authority as well, will continue to use whatever channels we can to make sure that our experience and voices are heard in continuing to push for this. I think a significant thing that I've not mentioned on the slide, but is the local government outcomes framework, which actually has an indicator to look at the alleviation and eradication of child poverty at the local level. And I think that gives a significant opportunity for us as a local authority to work with government to bring some of these issues to central government and continue to push for a much more stronger framework and some legal protections in place around this strategy. But it signifies a great shift. It's really important. It's going to really help us in terms of how we develop the local strategy, our local anti-poverty strategy, certainly as we finalise the strategy, we'll be integrating some of those measures in terms of the child poverty element of the strategy. Thank you.
So back to me for next steps. So essentially, we're going to digest the findings from Resolve Poverty and the child poverty strategy, I would say, and use those to really, I think, finalise the anti-poverty strategy. It was in a good place already, but actually, I think this will, I guess, I think the work that's been done over the last 6 months will really enhance that. And in particular, I do think we're looking at focusing on impact and evaluation, because it is about understanding what interventions we're making, are making a difference, and moving from that kind of short-term cost of living approach into longer-term, more structural interventions that, will impact inequality. And we know that that isn't that's not a quick fix. That is going to take, a much longer perspective. We do need to, agree ownership and accountability for poverty. There's no doubt that this is a priority for the city. It's reflected in the themes for city partners through the partnership board, for the council. And I know it's one, child poverty is there in terms of the health and wellbeing board. So it's clearly there, but it's just about what is the platform that we use for delivering and monitoring. There is already some great work going on. The strategy itself, just as a reminder, covers 5 different themes. So child poverty, which we've talked about, financial inclusion, which is, I think the good work that we're doing around LIFT can really support that. Health, so clearly, I know there's work taking place from a health and wellbeing point of view that can be part of that. Housing, we know how important the quality of housing and access to good housing is for outcomes. And finally, skills. It's about supporting people in the city to access good jobs and opportunities. Over the next couple of months, we're already, I think, started that process. It's about, getting this up and running, but certainly what we would like to do is present the anti-poverty strategy to Cabinet as a formal council document in the spring. And what I wondered is the next meeting of this group, which maybe, is it March? Certainly what we'd be happy to do is bring the latest version of the poverty strategy. So it just means that you can, add anything that you want to endorse it before it goes into Cabinet. If that's okay. So I think that was the summary that we wanted to present. Happy to take any questions.
Thanks, Heather. That's really excellent. I think it was really important that you came today and gave us an update on the strategy, because, of course, it's nearly, certainly we were discussing this about last May, June time, and perhaps before then, and we were eagerly anticipating the strategy, and we had a particular focus on child poverty. And it's a little bit frustrating that the Resolve process has actually deferred the compilation and the agreement of the Derby anti-poverty strategy, but I hope partners can now get focused on the fact that we need a strategy, and then we need, from that we can then focus on implementation. And that's perhaps more important than fine-tuning too many small points. So hopefully all that will come together sooner rather than later, because the April-May timescale is definitely a year after this was already a big focus. But I appreciate that is out of your control to a large extent, and I know that you were waiting for the government's also deferred poverty strategies. So anyway, I'm sure that we would like to hear a little bit more at our next meeting. That would be great. Thank you. I think that a lot of great work is happening, and thank you for reminding us of that, because those interventions that we can do as a local authority and with partners do actually make a difference. They can't actually make always the biggest difference, but they do make a big difference. And I remember we did have, if you remember, we had the Child Poverty Action Group come to address this meeting last year, and one of the things they were very clear on is that lifting the 2-child benefit limit would be the biggest single factor in reducing child poverty, and I'm pleased to say that that action has now been taken by the government. So whilst I do acknowledge that there may be some limitations in the child poverty strategy as delivered nationally, and that doesn't, and whatever's happening nationally, it doesn't absolve us from doing what we can locally, I think. I still think it's worth recognising that some big and critical steps have been taken since we were last really focused on this issue, particularly on child poverty, in relation to trying to do what the system can in terms of reducing poverty. So I think that is significant, but there is always more to be done. And as you said, Heather, in the end, you know, skills, employment, these are things which will ultimately lift the majority of people out of poverty. So they remain very significant actions on the part of the Council and its partners. So a really, really important report, I think, really valuable. We do want to see that strategy in place. We do want to start implementing and discussing how we can do everything we can as partners to help people, really. I know you are doing everything you can, Heather, but it needs to be a bit more integrated under the strategy, doesn't it? Anyway, I will shut up there and I will ask others in the room if they've got comments or questions for Heather. And Councillor Heather Graves, come in there.
Well, thank you, Chair. Immense thanks to Heather and Jenny for driving this forward, getting everybody around the table that can add value to the final anti-poverty policy. It's great to see how the Council makes maximum use of the voluntary sector in partnership with the voluntary sector, DF40, Community Action Derby, and in particular Youth Alliance, because we talk about financial poverty, but there's also poverty for children who are in households where there is poverty. It's poverty of opportunity and experience as well. And that can't be good for mental health and all sorts of things in terms of their personal development. And that's mitigated by the HAP programme, clearly, but also the Youth Alliance and the offer that we have for our young people in the city, so that helps the whole person, the whole child, not just to alleviate poverty, but all those things that they are denied, maybe, in comparison with more well-off peers. And I'm glad the skills were mentioned, because clearly skills are an important way. And I think figures show that people in the 30s and 40s are taking advantage of that and becoming, as a result, one would hope and expect, more employable or capable of getting a promoted position with better income. So the whole family benefits. So it's great to see that the lift tool being used, and the council clearly needs to use this policy to go across directorates. And I know that council tax support changes are afoot, which will make life easier for some people on low incomes, whatever band of house, if they qualify for council tax support, because an element of that will be reduced, so that they will have more money in their pocket for other things. And that, of course, may avoid people going into debt, because they may feel that they absolutely need to pay their council tax, and they end up in debt as a result, which obviously, with interest charges, makes it more difficult to manage their income on a monthly basis. So really good to see all the progress that's been made. It's been a big table, and I actually started on this journey with Heather and Jenny in my previous cabinet post, and it's really great that I know that it will have an effect across generations, but in particular for children in households experiencing poverty.
Thank you, Councillor Hazelgrave. Any other comments or questions? Councillor Wright.
Thank you, Chair. I'd really like to commend the authors of the report and basically express a degree of optimism for the amount of work and dedication that's gone into producing the strategy. And I'd like to echo some of the things that my fellow councillor, Paul Hesselgrave, has mentioned, so I really won't repeat, other than just to ask for information in terms of working across and working with partners. And I just would welcome some more information about the extent to which this strategy, child poverty strategy, dovetails and links with the whole Families First agenda, because ultimately, ideally, what I would have liked to have seen as a theme, as a heading, is family stroke child poverty, because children are situated in families, and being poor, a poor family, is really, really, really hard work. It's hard work being poor. It really is, in all sorts of ways. So just a little bit more information about the relationship and the link between the child poverty and the Family First agenda. Thank you.
Thank you, Councillor Wright. Are you able to respond to that, Heather, Sue Ann would be able to respond to it if she were here, but...
Just to say that there is a very good linkage between the Family First programme and child poverty. I do think it's an excellent suggestion, actually, that the theme in the poverty strategy could be family and child poverty. And I think that would be a nod towards that. So actually, Jenny and I have just discussed, and we're going to change that. So thank you very much for that suggestion. But certainly, I mean, I know the Family First programme is evolving, but we are very conscious of that. And I know Sue Ann and Sarah Walker, who are leading the Family First programme, they are, you know, we're working with them to just make sure that they do complement each other. But I think it's an excellent point. And actually, if I can just respond to Councillor Hesselgrave and just say that, you know, a big thank you to him for his work, because he is right. You know, in terms of the formation of the cost of living offer, and the work that we've done on poverty, Councillor Hesselgrave played a key role. So thank you to him.
Quickly, Chair, is that a recommendation then? That we add family?
Well, it's just been accepted, Councillor Wright, so I think we don't need to formally do any more than that, because the person that matters has just accepted it in the room, so I'm sure nobody's going to object to that. So I think we do have our next Health and Wellbeing Board meeting is focused on children again, isn't it? So I'll look at see whether, I don't know, if we got, it's not Sue Ann speaking though, is it, on Family First? No, but the whole of the next Health and Wellbeing Board practically will be focused on children's situation around children, so that may weave into it somehow anyway. Thank you. Ian.
Yeah, thank you, Chair. Councillor Wright was saying how this agenda dovetails into Family First, and I just wanted to briefly mention that it also dovetails really nicely with the government's new national plan to end homelessness. Whereas that national strategy was long awaited, the housing industry was taken somewhat by surprise by the government's publication of the plan to end homelessness. Came out in December. It's very, very much welcomed, of course, and the thrust of that plan is to reduce homelessness generally, but it has a particular focus on children, and Heather was talking about the importance of children with this in the agenda. And the national plan to end homelessness it's partly around greater prevention generally for homelessness, but it particularly targets children who are living in bed and breakfast and children who are in temporary accommodation generally. And so as a response for that, we at the council are changing our strategic housing responses to give a much higher priority to giving children who are in TA permanent and settled tenancies, so that family knows that they are in that home permanently and therefore can put down all the roots that are so important to helping families and communities become established. So I just wanted to mention that, Chair. Thank you.
Thank you, Ian. And in fact, I don't think we do have anyone here from Derby Homes, do we? No.
Apologies, Chair, today, yeah. Claire Mabani comes, yeah.
Doesn't attend anyway. I think she was sometimes call. We don't have anyone here from Derby Homes for a while, I think, and that is. I'd just like to note that as unfortunate, because in terms of, I presume they're working in partnership in some of the other forums, are they, Heather? Because just a minute, Councillor Heather. Because I think, in fact, I've omitted to make this point in relation to the smoking, actually, as well, Ian. When we talked about smoking before, you did say you would pick up, see what we could do, or whether it's yourself or Derby Homes, actually, through sharing smoking cessation advice or how to find help through Derby Homes, but we don't know that. And I also think there's a lot they could do through our social housing providers generally, not just Derby Home, in terms of working with people and addressing this overall strategy. So, yeah, it would be helpful if they were here, really.
I can pick that up. I'll certainly pick up the smoking cessation discussion that we were having, and I can talk to them about attendance at this meeting, Chair.
Yes, thank you. Councillor Hazelgrave.
Chair, I might be helpful in terms of families in temporary accommodation. I asked for a briefing from a senior member of Derby Homes who told me that working with the council and with the voluntary sector as well, and also absolutely with our family hubs, an increasingly high quality offer is being rolled out to families who are in temporary accommodation and all sorts of issues to support them and their children to thrive in the most difficult of situations. For example, in some cases, families have to be split up within some kind of bed and breakfast place or hotel, and some of the family are on one floor and others are in a different room on a different floor. And clearly that is why we have to prioritise families in temporary accommodation, particularly with children, with children and little ones, that they get some kind of more anchored setting, shall we say. I mean, there's always more that could be done, but the offer is there and it's rolling out, and the family hubs and people who are in temporary accommodation taking advantage of that, and also the smashing work being done by the youth YHA. Is it Y? No, it's not YMCA.
YMCA Derbyshire.
Sorry?
Is it YMCA Derbyshire?
YMCA, yeah, YMCA down on Parcel Terrace in my ward, which offers all sorts of things as well during the evening to families. So that offer is there. More can be done, clearly, and we just need to eradicate the whole issue of families getting into that situation, which is often not from their but not their fault. So I hope that's helpful to put that in a context that support is there and it's increasingly of good quality.
Thank you, Councillor Hazelgrave. I'm mindful of time now, actually, so I'd like to... That was a useful discussion, a good discussion. Unless there are any other really burning questions, I'd like to thank the authors for that report, for coming in and talking to us today. We would like to hear more, and thank you very much. Yeah, we'll hopefully perhaps see you next time, or certainly the time after. Thank you. So now we are moving on to the Community First update, which I think Jim Austin is going to deliver because Andy Appleyard has had to send apologies. So Jim, thank you.
Actually, Gamal's going to kick off, and I'm going to tail it because Gamal's here instead of Andy.
I stand corrected. My apologies, Gamal. I knew you were here. I didn't realise you were also presenting.
No, that's thank you very much, Chair. Yeah, just by way of introduction, it's a joint report from Jim Austin, Chief Executive of Derbyshire Community Healthcare Services, and myself, Director of Commissioning and Delivery across adult social care. Chair, just a little bit of context firstly, and then Lindsay will play a video and then hand back to us to talk through some key points in terms of the report that's on the agenda as well. I just wanted to share, Chair, that this is a really good example of integrated working between Adult Social Care, Derby City Council, the ICB and Derbyshire Healthcare Services, and we're very keen as a system to doing more and more of this, and there's a lot of work that is underway in terms of further developments in the future within this space, and that joint partnership across health, Derby City Council, Adult Social Care is vital. So just a little bit of context what this is. Community service is a joint service between Derby City Council and Derbyshire Community Healthcare Services, jointly delivering a range of reablement and urgent support services aimed at helping people remain independent and at home for as long as possible. Those services provide a range of things, including nursing, occupational therapy, physiotherapy support, with about the importance of independence and helping people return home rather than long stays in hospital or residential care, as it were. Again, brief context, we'll go into a bit more detail in the main body of the report. Was established in 2024, a lot of groundwork done prior to that, so it's kind of 2 years in operation now under a formal Section 75 agreement, and I know, Chair, you're part of the board that oversees this programme as well. Around a £10 million budget, and combined workforce, because it's brought the workforce, the council's workforce and the health workforce together to make sure we support individuals for the best service they can receive in terms of independence, and it's gone from strength to strength. So if I just pause there, Linz, invite you to play the video, and then Jim and I will come in for a little bit more context.
Tend to support people to prevent hospital admission, and we also promote independence and return to independence when they come out of hospital. It's been quite an interesting journey for all of us because it's bringing together what we already did as two separate teams, the Home First team, which was Derby City Council, and DCHS Rapid Response. So it's building those two teams and bringing them together. And it's been a real change in culture within our service to think about strengths-based assessments and how we put that person at the centre of our care in a social care way as well as a health way. So thinking about the next steps, we're bringing the two services together on Pathway 1, which is people in their own homes coming out of hospital. So that's a big lot of work that we're doing on the digital integration, so using a shared care record, documenting on System 1, which we're hoping will go ahead for the 1st of October. And also it's really nice in that respect that we're bringing in the social care element as well. The social workers have access to System 1, and then they will be able to document on the same system and see that documentation, so we can have a really nice joined up care as well.
I think social work does add value to community health services. I think we bring a different perspective, whereas our health colleagues predominantly focus on the person's health needs and recovery. I think we look at the bigger picture. We focus on that person's social needs, their economic needs, housing. We look at their culture. We try to overcome barriers that prevent people accessing resources. We work to safeguard those customers. We make sure that people have equitable access to resources. So together with our health partners, we work holistically with the person and their family to improve their health outcomes and improve their well-being and their quality of life. Our experience of moving into DCHS has been very positive. We've felt very valued. We've had visits from the executive team to meet with my team. I think DCHS have made great efforts as well to actually find out what it is that we do, because social work is one of those roles that is actually a little bit of an unknown quantity. The staff team found the transfer with talking about salaries and terms and conditions, that was seamless. My team are making really good use of training opportunities. 3 members of the team are already enrolled or have completed management courses, and we're now in the very early stages of looking at a social work apprentice route. The hospital to homes team primary focus is always to reduce length of stay both within the acute hospital and within all pathways. We are assisting with the implementation of community transfer hubs. We are working with our community first partners to improve the Pathway 1 offer, and we are now really starting to embed and look at how we can enhance our role with admission avoidance and the front door.
Thank you, Chair. That's just a little bit of context in that. In terms of just picking up key points within the report that's on the agenda, if I could just draw kind of some of the key points out from there, and Jim will confirm and outline kind of next steps and things that are underway as well. So the context as outlined, established in 2024, in terms of when it was set up, a number of services that were then pulled together as part of the Section 75 agreement and a pooled budget brought in. And from the council side, services that joined that arrangement were our functions around Home First, Perth House, Hospital to Home and follow-up team. And then from DCHS said, their services around rapid response therapy, nurses, support workers, and that was brought together to have an integrated offer to support individuals in that space. Achievements, just briefly, for 24-25, the transition and setup of services within DCHS and minimising disruption in that space, reviewing delivery models and real benefits about an integrated approach and simplifying the process for admissions and assessing of complex needs in that space. And as I say, most of the details outlined in the report itself. In terms of objectives for 25-26, again, continuing to integrate the service model and leadership structure across the whole service, almost mobilising towards implementation and steadying and improving. So good work around community-based Pathway 1 team, providing reablement service, a lot of work around the digital transformation space, and then moving into kind of much sharper, cleaner metrics around how valuable the service is, how well are we collectively doing, and be able to robustly report on performance within that space as well. So those objectives are outlined within the report itself. And in terms of activity, there's some charts and information in there where the activity has been improving and continues to improve significantly through Pathway 1, Pathway 2, in terms of referrals, assessments and support, and some of the metrics and statistics also show that, and the governance around this is very strong at board level and at operational level as well. It's a key initiative that we're very keen to continue to develop, but it is doing well, as I say. And then sort of final couple of points. The feedback is very helpful, and some of that's outlined here, because of course it's important to kind of hear the voice of people that are going through this. Has it helped, and is it achieving what we need it to be doing, supporting individuals going through the process. And then the final point for me is really, I can't emphasise enough, that integration approach between adult social care and health, and more of that will continue, and that partnership at a very senior level is working highly effectively across Derbyshire Community Healthcare Services, the ICP and Derby City Council. Thank you.
Thanks, Camille. So really very little to add. Camille's covered a lot of it. I think if I were to summarise this, it's been a long piece of work. So although this has been live for a couple of years, there was a lot of groundwork done by a lot of people for a number of years before that. If I look at the key impact on residents, on citizens. We are getting as many or more people home with a higher level of capability to look after themselves than we were able to before, with effectively a reduced capacity, because we are not buying in as much private capacity as we were before. So that means that we're retaining the money within the system that we can recirculate in a more effective way. The video that you saw was filmed about 5 months ago. We have seen it before, some of us at the Integrated Care Partnership. The good news is that they are now all on the same digital platform. We are deploying people universally on the same platform as well. So that aspiration around social workers being able to see the visibility of information, the same way the health can, is already realised. We are now embedding this work into the community transformation programme that's happening not only in Derby City but across the wider Derbyshire and Derby footprint. And this has been a pioneering piece of work that is now being looked at and observed and will be followed by other partners in the wider system. So just a huge amount of thanks to all the colleagues that have worked on this. I've been very hands-off, as it were, but we're very happy to take any questions about anything that's in here or the wider community transformation programme.
Okay, thank you, Jim, and thank you, Gamal. Yeah, really excellent report. It's another very positive report, actually, this afternoon, isn't it, in terms of outcomes when we look at the statistics and other aspects of it. But I won't say any more for myself at the moment. I'll just ask if there are any comments or questions from people in the room. Just before I bring you in, Councillor Heathergrave, I'll just see if there's anyone else. Could they? Well, as Councillor Kerr, so I think you've spoken moderately, slightly less than Councillor Heathergrave this afternoon. So I'll let you come in first, and then I'll bring in Councillor Heathergrave.
I really wanted to echo the way that it seems to be a really good development. It feels really positive. Certainly the video came across as being that, and from what you've said. Just one specific question. So one of the groups that wasn't specifically mentioned there, and it is quite a niche group, are people who have been held under a deprivation of liberty safeguard. Would this team also work with that cohort if they're now being enabled to return to a less controlled life?
So I think it would depend on individual circumstances. The teams are aware of DOL's deprivation of liberty, and so will appreciate that. They normally work with mental health colleagues in that space as well. So my trust is largely physical community health. Maria's here from the Mental Health Trust, but we would work in partnership across that. So it's on an individual case-by-case basis they can do, and they do, but as you say, it's relatively small cohort of people in that space.
Councillor Heathergrave.
Thank you, Chair. I am actually going to be mega laconic for me. It's really nice when we get a report to have that examples of feedback from people accessing community first. It really brings it to life and reminds us this is all about people. And what's really nice about this report, you've started something and you're getting really good outcomes right from the beginning. And you brought two teams together, and the expression was seamless in terms of what conditions of service and salary, but it looks like it's seamless in terms of those two coming together as well. So that's great. You've got that shared insight and skills that work together better, together rather than separately. So great, a great initiative and really good outcomes, and I'm sure that will continue and get even better. Thank you.
Well, thank you. We can definitely feed that back, if that's all right, Chair, to the team. And although it's reported as seamless, and it was, there's a huge amount of hard work that goes into making sure it is seamless. So.
Thank you. And just before I bring you in, I'd just like to echo that comment, Councillor Heathergrave, because that's what I was going to mention. I have obviously, I mean, I do sit on the board that oversees this, so I'm very familiar with it, but the feedbacks from people accessing Community First are quite heartening. And I mean, actually, whilst, because we tend to look at these things all the time in terms of graphs, stats and figures, but actually it's good to get some qualitative feedback. I mean, it's not a survey, so obviously we've just got the positive feedback, but it does literally make all the difference when people are a patient, particularly staying in a hospital or in Perth House, where they get friendly and helpful staff, treat them as human beings, who've got time for them. that actually makes all the difference. So would you also feedback from us our thanks to the staff, the frontline staff, many of whom I have actually met in the past. I went to see them on 2 or 3 occasions at Perth House, and just thank them for their continued work and actually delivering the service, because it's not always easy work, it's not always pleasant work, and it's not always work that's it's easy to achieve the outcomes. So that's really important. So I very much echo what you were saying, Councillor Hazelgrave. Thank you.
Thank you very much for this report. It looks quite a positive report. I was just wondering, because it's the issue of difficulty in discharging a patient from the hospital to the community, it's an issue that runs across the country. So it seems like you've got quite a good model. I'm just wondering if you have any plans to evaluate the outcome of this initiative, and any plans to disseminate the output so that the other trusts across the country will learn from your experience.
So yes, and actually I suppose this is part of the evaluation that you're seeing now. This is linking into what we're calling the Community Transformation Programme that's been running for just under 12 months now across Derby and Derbyshire, and I take that into national fora and regional fora to discuss and demonstrate the work that's going on. The Community Transformation Programme is broader than just health and social care coming together. There's a lot more there that can unblock flow, but I think the exciting thing here is, and it kind of alludes to in the video, the recognition of the professionalisms and the professional skills that people have from different settings, so social working versus health, is something of a barrier sometimes. And I think what we've managed to unlock there is that mutual respect across. So in simple answer, yes, I do take it to other fora for them to learn. Some are keen to learn and some are not so keen.
Thank you, Jim. I think at some point, well, as it progresses, it would be useful to have some feedback on the Community Transformation Programme, I'm sure. That is quite exciting, and let's hope it delivers what has been anticipated of it. I know that that's the intention of everybody involved. So any other comments for Jim or Gamal? No? Well, I'd like to, again, thank you very much for a really excellent report, and there are lots of details in the report that haven't been touched on, lots of graphs. Yeah, I'm glad it's going so well. Let's hope it continues along that same trajectory, and I look forward to hearing the next update, and certainly hearing more about the Community Transformation Programme. So thank you very much for that. So moving quickly on then to Robin, who's going to give us an update on the COVID Inquiry Module 2, Core Decision Making and Political Governance Report and Recommendations. Thank you.
Thank you. So we agreed some time ago at the board that we'd receive updates from the COVID Inquiry as it reports on an ongoing basis. So this is just a summary of some of the key points from the Module 2 report. A great deal of this report related to national government. It was focused on political governance, decision-making, and relationships within the devolved administrations, as well as the implementation of non-core measures. But as you go through the report, there are some areas where we can both be reassured that the inquiry has picked up on some issues that we experience locally, and also just reflect on the recommendations and what the consequences might be for us. So they're not direct recommendations to us in the local area, but something that we can consider and think about in our ongoing work. One of the key points that came from this inquiry, and the key point that's made in section 4.7, is that the view of the inquiry was that too little action was taken too late. And this was a clarification that lockdown was not the wrong response to the pandemic at the time. It was the only potential response to the pandemic at the time, but had earlier, less dramatic actions been taken, then potentially those actions could have been avoided or shortened. And I think that's a really important piece of reflection as we're looking at some of the other learning from the inquiry. The other key point for me was around the need for clarity on what is scientific advice and what is a political decision. So some really clear indications on what the scientific advice is actually saying and how those political decisions are come to on the basis of that scientific advice, as very rarely is anything black and white. So when we look at the lessons from the inquiry, I've summarised them in the paper, but the key areas were around planning, so ensuring that we think about different scenarios. There's a general reflection that we were planning for a flu pandemic, and a COVID pandemic didn't behave the same as the flu pandemic, and our actions were different. So we need to consider different scenarios, different at-risk populations, different pathogens when we're thinking about scenario planning for future pandemics. It's important that we think around the short and the long-term impacts of the pandemic, and not just that immediate response, and that there's clear objectives and decision-making, so that things are really clear and transparent and they're communicated well to the population, so that people understand what the overall aims of the actions being taken are and where we are hoping to get to. There was a key lesson to act early and decisively, and I think that came up not just at the initial decision around actions in March 2020, but also later on as we progress through the pandemic. The inquiry just reflects that at times decisions took too long to make, and the virus wasn't waiting for those decisions to be made and was able to make significant gains in infecting the population over that time. A real importance around working across government, so the linkages between the different government departments, and that all of us in public life consider our role as role models and demonstrate the importance of the actions that we need to take to our population. So really specific lessons around data, the importance of data and of testing, and just to reflect that, and I know we've mentioned this before, in local areas we were not aware at the beginning of the pandemic of who was infected and where they were within the population. Initially because the testing processes needed to be developed, but as that progressed, actually because the data sharing agreements weren't in place. And we are still in that position at the moment, so we don't have anything in place that would allow the sharing of individual personal data around who is infected with us within local authorities, which is absolutely key to us, both in supporting individuals if they're having to isolate, but also in that work that we were eventually able to do and we felt was really effective in that local contact tracing and support process that we were able to offer. So when it comes to the recommendations within the report, I've picked out the ones that are most relevant to us locally. As I said, it's not necessarily actions we can take, but that would have an implication for us. And interestingly, the first one is around the implementation of the socio-economic duty, and just noted that that came up through the child poverty strategy as well, so perhaps that is something that is going to be progressing. So this requires public bodies to give due regard to reducing inequalities from low income, education, place of residence and social class, as well as the protected characteristics. So it's much more encompassing around need within the population. The second one was around placing child rights impact assessments on a statutory footing. So there currently is a template to consider the impact on children's rights based on the UN Convention on the Rights of the Child, equivalent to an equality impact assessment or such assessment, but it's not currently a statutory obligation for public bodies. and it is recommended in the inquiry report that is taken forward. The next one was developing a framework for considering those at risk in an emergency, both from the infection but also from the response to the infection, to ensure that appropriate mitigations are put in place. And just as mentioned earlier, really important that we don't assume that the at-risk populations will be the same populations. I think there's some reflection on the closure of schools historically, and whether we would do that differently next time. Really important to just remember that if we had a pandemic that significantly impacted on children, that would significantly impact on our decision around keeping schools open. So we do need to be aware of that. So just that idea that we locally would have a way of thinking not only who's most at risk from infection, but these actions that we're going to take, who do we most need to support, who is most impacted by these actions that we are taking. And then finally, the recommendation there was around accessible communication. The inquiry particularly picked up on translation into BSL, but then also common spoken languages as well. And around that clarity of communication, really, really important that the communication is clear, but also that it's accessible and translated as we need it to be. So they were the key findings from my perspective from Module 2, but I have put a link in there as well for anybody wanting to look at the report. It is quite a considerable report. There's a lot of detail in there, but it is really interesting to see the depth that they're going to in the review and the conversations, and really hopeful that that helps us to be more ready for next time. Thank you.
Thank you, Robin. I mean, that is extremely interesting. I'm sure we've all got immediate comments that we could make in response to that, actually. But we haven't actually read the whole report, so some of the comments might be better taken in more context of the context of the report. This is for noting today, anyway. So because we're only 5 minutes left, I'm going to not take comments on it today. But at some time, it might be interesting to have this as a proper agenda item, so we can have a discussion and we can think about what we can do locally in order to better prepare for what people believe is inevitably the next pandemic. So I'm told. So I think that. So we'll leave that one for now. Thank you, and just take your update from the Health Protection Board.
Yes, thank you. So we met as a Health Protection Board on Friday, the 21st of November. Our next meeting is actually tomorrow. I think our meetings seem to be falling in that way at the moment. So just the key points that were discussed at that meeting. And these are standard agenda items for us. So we reviewed immunisation, particularly focusing on plans to improve the performance in maternity vaccinations and in school-aged immunisations, where we see there's considerable improvement could be made. We discussed infection prevention and control, and as we've previously discussed here, we do continue to have a gap in the IPC's support for care settings within the community. And we're continuing now that there's the development of the cluster of the ICB, we're continuing to have those conversations to see how we can resolve that. We reviewed the antimicrobial resistance work stream, and particularly how we can relate this to our work around health and care settings. So this particularly relates to things such as the use of antibiotics for some of our older residents with urinary tract infections, for example. We discussed tuberculosis. There is an increasing amount of work around tuberculosis with the establishment of a regional working group and review of the national strategy. This is because there is nationally being seen a gradual creeping up of the numbers of tuberculosis, and really just that recognition that we need to do more around that. And no surprise in November that we had an update on winter viruses and what was anticipated to come over the winter period. So very happy to have any questions on any of that at this time, Chair.
Thank you. If you'll bear with me, Robin, I think we'll not take questions because we're pretty much at the end of time. But there is, I'm sure you could take any questions actually outside the meeting, after the meeting, or via email. There's a lot there that I could say as well. I'm sure others feel the same. I'd like to know more about this TB, but we don't have time. So we'll leave it there for now. But thank you for those reports. Both very useful and interesting. So it just remains for Alison to say a quick one word on the Health and Wellbeing Board forward plan.
So probably just a couple of words. So obviously this is for information as well. Set out kind of the plan for the March meeting, but we'll look if we can accommodate the poverty strategy, and we'll set out the other proposed items and kind of a schedule of meetings across the year. But also just to reflect on kind of the comment earlier around kind of the neighbourhood development planning and the potential to incorporate those in future meetings. And also there's, I think we need to look at the terms of reference, because some of the system changes and the implications for representation. So there are a couple of items that are not yet referenced on there that we will include. So thank you.
Thank you, Alison. Sorry, I meant you had 1 minute, not one word. I mean, one word would be incredibly succinct, wouldn't it? Okay, thank you for that. So we'll have to come back to that on the agenda planning, because there's more there than there's some important new developments. Okay, well that just remains for me to say thank you very much for coming this afternoon and for all your contributions. We look forward to seeing you at the next meeting. Thank you. Bye.